Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the Phia Group.
Hey, everybody. Hello. Welcome to another Empowering Plans with the Phia Group podcast, the Empowering Plans podcast. This is Ron Peck, Chief Legal Officer of the Phia Group and new father again. You know, it's been 7 years plus since the birth of my first child, and I guess enough time passed that my wife and I forgot the horrible mistake that we had made, and we had another one. Yeah, and, you know, unlike the first, my second son, he doesn't really cry much. He's upbeat, he's chipper, he's happy, as long as he's being held all day and all night. But I'm not going to allow exhaustion to stop me from recording what I believe will be the best podcast of the year to date. Pat, the podcast producer Santos, am I right? I think this is actually the first podcast of the year. That was a dad joke. You know, it's like when I tell my kid, I'm the best dad you've ever had. It's like, Daddy, you're the only dad I've ever had. You know, you got me. But no, I think we're going to have a really good one here. And who knows, come December of 2023, people may still be saying, man, it was all downhill from there. Speaking of going downhill from there, with me today, co-hosting today's podcast, the one, the only Senior Vice President of Consulting, Jennifer McCormick. Jen, how are you doing?
Brian, I'm hanging in. I'm not quite as exhausted as you, but I'm hanging in.
Let's see what we can do to fix that, Jen. You know, I was thinking about what we were going to talk about today, and you had sent me an email with all sorts of different issues and topics and things that are already really dominating the airwaves, and in particular, some items that employers who are sponsoring a health benefit plan, those entities that are advising them or processing their claims, administrators, you know, these are sort of the benefit areas where plans are woefully inadequate, especially given current demand. We're watching sort of the shifting tides, not only in healthcare, but in society in general, because as things change at a societal level, healthcare usually follows. You know, if people are really sort of focusing on getting out there, getting physically active, you know, next thing you know, you're going to want to make sure that your plans are covering people who are suffering injuries during hiking and mountain climbing and adventures. You know, that's just one example where you sort of see the trends. I remember early in the pandemic when people were off the road, you know, day-to-day fender benders were not really happening with regularity, but those one or two really big accidents where somebody was speeding on an open highway, those picked up. So, you know, your benefit plan was affected. So as we see changes in society, there's definitely that trickle-down effect where it affects your health plan. But before we talk about the changes that we're seeing in society and how it's going to impact these benefit plans and how to react, you know, I thought we could start by talking about some of the things that we had predicted in the last few years, where we thought we would be at this point. And it's really funny because you look at the calendar and it's 2023. I can't believe it. You know, and I was trying to explain to my son the other day, the book and then the film adaptation, 2001, A Space Odyssey. And I was explaining to him that back in the year 2001, in reality, it was nothing like the movie and nothing like the book. But it was funny to see what the author and the director of the film, you know, what they thought the world would look like in 2001, right? And people were spacefaring. We were going and we were colonizing the moon and exploring Mars and living on these spaceships out in space, right? That's what's going to happen in 2001, they thought. And yet, one of the passengers on one of these space cruisers is calling back to Earth on a rotary phone off the spaceship, right? You know, and he's having a video call in black and white on this big television set. You know, and it's funny because you think you got it and you don't. And admittedly, we like to talk about all the things that we've gotten right, but rarely do we really talk about the predictions that we've gotten wrong, Jen. And I got to tell you, I'm a little bit surprised. I thought a few years ago when the ACA, Obamacare, remember that? And the exchanges were first introduced to the American society, you know, I thought that you were going to see either pushback against the exchanges in favor of private self-funded and private fully funded employer-based health plans against these exchanges, or I thought you were going to see sabotage on the part of regulators and lawmakers to the point that private insurance was no longer affordable and everybody would become dependent first on the exchanges and then eventually on the government option. And in some states, I think Washington was one state and others, where they were really promoting the government option on the exchange. I thought that was sort of the beginning. And I got to tell you, it hasn't really gone in either direction all that much. And I'm worried because, Jen, that for me was the biggest thing. And if you go back and you look at the podcast and webinars, I was certain that from a legal and regulatory standpoint, but also from just the cost of care, as the cost of healthcare continued to increase, that private insurance was going to be made obsolete, that they were going to price us out of the market in order to try and force people onto the exchanges in order to fund the high-cost patients who were on the exchange. You need all the healthy people who don't file claims to pay towards the people who are on the exchange who are high cost. And it's happening, but it's happening much more slowly. With the No Surprises Act, it's just one more example where they're bringing balance billing and all of those sort of weaknesses of the current insurance model to light. I still worry about it, but it hasn't happened in any kind of extreme speed that I thought it would take place. And the one place where I think we can really shoot ourselves in the foot, and we don't really need any help from lawmakers or regulators to make traditional insurance look bad and make this concept of potentially Medicare for all, when was the last time you heard that, look really good. And that is when somebody is in desperate need of healthcare. Something is afflicting them, something is concerning them or a loved one, and their plan either doesn't provide coverage or provides inadequate coverage. So even though I haven't seen a major shift towards this Medicare for all narrative, and if anything, it's quieted down, and I haven't seen any major legislative or regulatory efforts to sabotage traditional insurance and sort of push everybody into a public exchange, I still worry about the potential for us to shoot ourselves in the foot by not offering the best possible coverage for the lowest cost. And with that, Jen, I would like to ask you, what are you seeing from a societal standpoint, an area of care where you think people are in desperate need and many plans are falling short?
Yeah, so that's a great question, Ron. And I think now we're in this space where it's a new year and we have gotten past all of our concerns at the end of the quarter and trying to reach targets and trying to reach goals. And now employers are coming to us saying, we really want to make sure that we can continue to recruit and retain our employees. So I'd really like to take a critical look at our benefits and see what it is that we can do to make sure that our plan and our offering is the best out there, the best that's possible. And people are coming to us and asking for us to review and analyze the benefits to say what potentially can they do better and how can they do it. And we're now taking a more holistic approach when we're looking at benefits, and it's not solely just looking at the actual medical benefits themselves, because we're starting to see that the generation of new recruits, people that are out there looking for positions and looking to join companies, and for the companies looking to retain those employees, they're looking at a broader spectrum of benefits, which include scheduling, more wellness, mental health type benefits, as well as those medical benefits. Those three components are really going to make up how the employees are going to best feel balanced in what they're looking for. If you're looking at it from the perspective of an employer, some of the things here that we have really done as a result of COVID and the current environment is being more flexible. So there is the opportunity now, there's a lot more stress when it comes to, Ron, you mentioned it, being exhausted. It's real. We're dealing with more issues coming out of the pandemic and COVID as kids are returning to school, or more of a normal type of school setting where things are starting to calm down a little bit. But in addition to coming out of this, we've had situations where kids in schools have been wearing masks for years and years and years. And now that the masking has started to relax a bit, we're starting to see more cases of the flu and RSV and still some more cases of COVID. So instead of now just dealing with COVID, parents and children at school are having to deal with a whole host of new illnesses, which is keeping them home from school, And it's creating even more stress and exhaustion for parents that we're trying to figure out how we can deal with it. As an employer, one of the benefits that we can look to is seeing if there is maybe some sort of flexibility in the schedule that we can offer for our employees to make sure they can balance the mental stress, not only on the children for having to go through all those different illnesses, but also on the parents who are trying to keep all of the things together and juggling all this at the same time. It's very difficult and very taxing. And if we can recognize and are aware of this potential consideration or concern, then everyone at the end is going to be more effective at their job and more productive on a day-to-day basis.
It's funny you say that, because as you're talking, I'm looking at a sign on my desk and it says, "You can't make everybody happy. You're not a taco." And, my concern, and this is kind of what you're talking about here, is that 10 years ago, I was certain the only thing that can take down an employer-based health plan, a self-funded plan that's really cost-effective, people love it. You remember when people first started to talk about Medicare for all, there was a lot of chatter on social media and even on the news and all media. They were talking, "Oh, no, but I love my plan. I love my employer plan. Don't take my insurance. You can't take my insurance," right? And that's what people were saying. And I thought that they were going to have to do things from a regulatory and legal standpoint in order to raise the cost, hyper-regulate insurance, to make it too expensive to offer benefits. At the same time, offer a public plan, some sort of public option, government-funded option that was just so low cost, high benefit that people couldn't help but move to it. I thought that was the only thing that was really going to sabotage private insurance. And, it cut a decade later. And what you're talking about, Jen, is actual need. People saying, "I'm suffering from this condition or that condition. My kid is sick." Suffering. You mentioned mental health, which is, I think, a big one. And like I said, you can't make everyone happy. You're not a taco. I look online and I see people complaining, "My health plan isn't paying for this," or "My plan doesn't provide coverage for that." Screw my plan, screw my insurance, screw my employer. I hate these guys. And the negativity and the vitriol and the negative attitude from people who 10 years ago were saying, "I would never do Medicare for all. I love my insurance." Now they're saying, "I hate my insurance because they're not providing adequate coverage. They're not addressing my needs." And that's what I'm really worried about, is where, I remember all those policymakers and the people who were so in support of Medicare for all and socialized medicine and, a public national exchange and national exchange option and government option on the exchange. They were so anti-private health insurance and so anti-employer-based benefits. All their effort and all their talk, they couldn't take us down. But now I worry that we're going to take ourselves down. So, with that in mind, Jen, and I'm dependent on you because you're on the front lines, right? You're the one that the brokers and the employers and the TPAs are talking to. What would you say are the 3 areas where people are looking for benefits, looking for coverage, looking for their plan to be generous, but generally speaking, these plans are falling short?
Yeah, so where I was kind of going with that before too is there's the 3 areas where people are hoping to see benefits. They're hoping to see additional access. The number one area right now that we're being asked about is mental health. People want to know what it is that they can do. We know that there are the rules, there are the regulations out there that are mandating written analysis to ensure compliance with how mental health benefits are being provided. And as we're going through this process and doing this intense analysis, we're realizing and opening eyes for employers when they have been receiving questions from employees who are maybe suggesting that the benefits as they were written in the plan were not in parity. And only by doing this intense analysis are they realizing that, oh my, maybe the benefits that I'm offering on the surface appear to be in parity, but they are not. That is the area, making sure that there are the opportunities for the care for adults and for dependents, for children, that there is that broad spectrum and we're not putting any limitations on therapy, ABA therapy, autism treatments that wouldn't otherwise apply in the context of the medical or surgical space. I would say that is a big area of concern. That's going to be a continued concern as we're seeing all of these illnesses, all of these considerations for what families are needing to deal with in the new 2023 year. I would say the next area that is of critical importance for employers, we know, we see this ourselves, that when you're looking at your budget, healthcare is expensive. It is one of the top costs and things that employers are faced with when they're looking at their budgets year over year. And they're looking for ways that they can still increase the benefits that they are offering, but finding a way to do it as affordable as possible. And one of the things that we have found that's not only cost effective, but effective as a treatment strategy is incorporating newer ways to offer telehealth services. We have seen that the rules and the regulations are expanding, particularly in the context of high deductible health plans, because of the concerns there with preventive care versus what telehealth is that we got so used to accessing our physicians through the phone, through FaceTime, through our computers, that having this standard has become a way of life for so many people. It's more convenient, at least for me, to call into the doctor, to schedule a FaceTime visit with the doctor, as opposed to getting in the car, picking up the kid, bringing the kid there in order to get the services that you need. I would say if you're looking for access to care that is effective and also affordable, telehealth is one of the things that you should really navigate and make sure that that is an offering under your potential plan. And there's a variety of different telehealth services that could be available from a virtual type of setting. And I'd say the last thing to keep in mind when you're looking for benefits and what employees are looking for, sort of tying everything together here, is really looking at how leave is being provided as an employer benefit, and then how are benefits being continued as a result of that leave. So we know that there is the federal FMLA, but so many different states are offering their own definitions of paid medical leave or unpaid medical leave. And as we're tying all of these different benefits at the state level, at the federal level, and even some are offering at the city level, taking a look at those different types of leave policies that are available, are our benefits in line with what the leave is offering? We need to make sure that there's not going to be any gaps. So the comprehensive review needs to not only include looking at our benefits themselves, but the supporting and the supplement documentation that would support where the individuals are looking for those different benefits. But those are, I think, the top 3 areas that we're really going to have to look for as we're trying to improve in offering benefits for employees. They're going to have the most bang for their buck in so many different reasons.
You know, Jen, very well said. And I recall, I don't want to say how long ago it was, but I remember in undergrad, one of the courses I took, microeconomics and macroeconomics and these concepts of supply and demand. My father has a PhD in economics, will kill me if I get this wrong. But as the demand goes up, if the supply either stays where it is or dips, the cost naturally is going to go up. And in healthcare, we often say that there's no rhyme or reason behind the pricing. Two providers could be doing the same exact procedure. The one who does a better job and has a better track record charges less than the one who tends to make a few mistakes here and there. There's no rhyme or reason behind the pricing because there is no transparency. But I do worry that even if everything made sense and things were transparent, just based on the rules of economics, if the supply stays where it is or goes down and the demand goes up, naturally the price is going to increase. Then when you add, all the things that afflict healthcare pricing and cause it to sort of be out of control sometimes, it's just going to make it worse. And looking in particular at mental health and mental health care, I think that anybody who either themselves have been seeking help or in particular are looking for help on behalf of their child, they're definitely finding that the supply is low, the wait lists are long. Would you say that that is potentially a major threat for our clients, these plans, that as they start to offer more robust coverage and benefits for mental health care, both for the member and their dependents, and thereby prove the value of the employer-based health plan, and once again prove that socialized medicine and Medicare for all is not the way to go, and nothing can beat a private health benefit plan, particularly a self-funded employer-based health benefit plan. As they do that, are they potentially opening themselves to abusive price gouging on the part of the providers, because of that limited supply?
I think you're absolutely right, Ron, and recognizing that just because we can't physically always see for ourselves or for our children a boo-boo, it doesn't mean there isn't one there that needs to be fixed or addressed in some capacity. So there are a limited number of providers, there are long wait lists, there's long lines and a short supply of these types of services that are available. And by opening this up, instead of having the anxiety and the months and the waiting and the potential disciplinary issues that could ensue if this is not addressed, it is important to recognize this as a concern and open up the benefits and make sure that they are available and accessible for parents and for children and for dependents who need these. This is a focus not only of what employees need, what employers want, but the regulators as well. This is a spotlight that is being put on this area and something where we need to pay attention to it before it gets any worse.
So basically, the parting words are be generous, provide robust coverage so that people won't be posting on the internet how much they hate their health plan, how much they crave Medicare for all, but at the same time, like a brick wrapped in silk, also be sure to educate your plan participants, make them educated consumers of healthcare, ensure they understand that sometimes the best care is not the most expensive care. Shop around, get the best bang for your buck, and avoid those who are looking to abuse the system. Leverage the different tools that are out there to help you identify care that's available to you, but for the best quality at the best cost. So it's sort of that 1-2 punch. Provide the benefits, but also provide the education, and also implement tools and services and work with partners who are going to help you monitor the claims for those abusive providers to identify mistakes, errors, situations where somebody else may be responsible to pay. There's so many cost containment opportunities out there. You don't need to cut away at the benefits in order to save money. The money is out there, and you can still provide robust benefit plans. Would you say that that's an accurate assessment, Jen?
That's right. There are ways that you can offer more benefits for less money, but you just have to be thoughtful and you have to make sure that you're looking at the full picture. But more benefits doesn't always equal more money.
And you need to work with Jen McCormick. Speaking of working with Jen McCormick, today has been such a pleasure chatting with you, Jen. I look forward to coming out of this baby-based cocoon at some point and seeing you in person. But until then, it was such a pleasure hearing your voice and talking today. I really think that this is the area where we're going to be focusing on in 2023 is, identifying those new and emerging areas where people are really in need of healthcare. Supply is low, and finding that way to balance both providing the coverage, but also monitoring the claims and fighting the bad actors. And I think that that's going to be a major theme for the year. And I look forward to engaging in that battle for good with you, Jen. So on behalf of myself, Pat, Jen, everybody at the Phia Group and our entire industry, keep it up. You're doing great. Stay strong. And I'll see you on the road soon, I hope. Thank you once again for enjoying and joining the Phia Group's Empowering Plan podcast. Be well.